ginhawa, and then check po na ko ang imuang BP. So, you really have to tell or converse with the patient. And as much as possible, as you can gather data, mas better. Like when you're asking for what's their history, for example, pwede po na ninyo magama. Alright? Sige. So, ma'am, I check your temperature. So, as much as possible, cotton ball, and then you clean this one. Okay?
Before and after.
Yes, as much as possible. Sige. Cotton ball. Okay, most likely, first hand, bulb first, circular motion, going up. They get that. And then, open. Okay, so ma'am, dinhi ko sa imong axilla mabutang or sa imong ilok ng butang. Is it ischemically? Buot. Okay. Okay na ba, ma'am? You really have to make sure na makita mo nga masunod siya, ha? Sige, ano. Sige, mag-beep na siya, ma'am. Okay, that will be the time. Okay, mauta, ma-stop na siya, and then that will be the register. Okay, i-carry na to. You get it? And then while you are actually doing this, you can already check the pulse of your client. So, ma'am, pwede na ko ka-check sa nimo ang pulse. Karon? Okay, so as much as possible, don't check the pulse on the arm side wherein you place the thermometer. Otherwise, malihok-lihok ka na din ang dapita. They get it. So, hold 2 digits. Okay, so okay na siya, ma'am. So, don't wait ha, nga mahuman ka usa. 5 minutes every procedure, dili. Simultaneous na siya. So, ma'am, you have 35.6. Every after nga makuha nimong register, you have to let the patient see. And make sure nga kamao ang pasyente. So, pila to, ma'am? Ang temperature?
35.6.
Sige, ma'am. Sige later, ma'am. If you want the better, if maka-provide ka paper sa iya, ha? So that at least naapod sa basihan, ana. You get it? Now, once you get the pulse this time, okay, you have to make sure that you have your clock with you, and then the long hand is actually working. Okay? And you have to make sure that you count it for the full minute. They get it? Kaning pulse. You really have to feel the pulse of your patient. Okay? So while you're doing that, ang patient mo actually is also observant. There are some instances that your patient might be suffering from your white coat syndrome. Ang imo ang patient. Malahi ang iyang vital signs, it's because the patient is anxious sa imuha nga caregiver who is wearing the white uniform or who is wearing the uniform nga naa sa hospital. They get that? Full minute, ha? Now, say for example, second time that you're going to get the vital signs of your patient, you can do that, okay, by multiplying it into 2. At least 30 seconds at taking. They get it. Okay, full minute na siya, ha? And then for the full minute that you've done this, you may continue already checking on the rise and fall of the chest. You don't tell your mom nga, mama, check ko sa imong paginawa, because there are some instances that they get to control it. Okay, they become very conscious. Sometimes it goes higher. It's sometimes medyo mas deeper ang ilang breathing. They get it. So you have to notice the rise and fall of the chest. So 1 minute here, 1 minute doing that, even if your finger is still here. They get the point here. Harong di mag-conscious ang inyo ang patient. So minsan you can do all these things actually simultaneously, one after the other. In the event, say for example, I'm doing this already, and then nag-buzz ang iyahan mismo nga thermometer, you stop and you do it again. Do you get it? Kasi ang imong target din is you do as many things as you can, okay, in a lesser period of time. Do you get it? Okay? And then after that, ma'am, I'm going to get your BP. Okay, and then while doing that also, pwede na ni siya, on the other hand, ang imo ang pulse oximeter. Do you get it? I'm not sure, I haven't checked this yet. Okay, ang imo, kamaunang patient. Oh, sige, kamaunang patient. Ang register sa imo ang pulse oximeter, usually gamatter siya, most especially if you have a cold environment. If cold ang fingers ng imong patient, marong register ni siya. Okay, in the event na very, very low wood siya, you have to look for another pulse ox and then use it on the other hand. Okay, or if you want to, you can warm the hand. It will stay there, don't worry, it will not harm you. That's 95. Okay, and then it will go higher pa. In the event, say for example, nag 95 na siya, that's an average. normal. But as much as possible for normal individuals, ang scale will be 95% to 100%. Kasi pag 95 ra good siya, and wala siya ng cut-cut, right now it's 98% already. On my end as a caregiver, I have to do something. Meaning say dili 100% ang iyang oxygenation. So means I would most likely tell my client na, ma'am, pwede ka deep breathing. Ipa-deep breathing mo siya. Because you will be surprised kung cut-cut na siya, mutaas na siya. Do you get it? Alright? Sige, because there are other things that goes beyond this register here. Do you get it? Now, what else is true here? Baro. Kani, this is the oxygenation, kaning 99. Ang 87 will be the pulse. Do you get that? So, there are some nga they actually register na lang what's placed from here. But I would really recommend that you do it also manually. Do you get it? I-manual ko na siya nimo. Okay? Sige. And then you're going to check the BP of your client. So, mga check ko BP mo, ma'am. Check na ka BP nimo before. Unya? Kamusta? Pila man, okay, pila man itong iwang BP, ma'am? 130. 100? 130 over 90. So make sure na di tight ha. Okay, and as much as possible, it does not go over the clothing sa imuhang patient. O assuming, anong bit na mag-listod, 2 to 3 inches kani, this is your guide here. Okay, kaning mga arrows nimo, and this one has to be inside. Okay, and then make sure kani, you need to have a bigger cuff by the way. O when dako dapat nga cuff sa ato ang mga kamot. Okay, and then this time we do the palpatory BP taking first. Katong what you usually do sa mga usual nga monitoring ra, you do it shortcut. The shortcut ra mo. Pwede ra na siya. That's why our baseline usually that we are referring to is 120 over 80. So means say we are always assuming oftentimes that the BP of normal individuals is 120 over 80. The reason why automatic na ka, direct. Okay, but if it's really procedural, you really have to do palpatory type na BP taking. So you palpate. Sorry, ako na-check. And then by the time mag-stop or maghunong, ma-feel mo sa inayon na lang. First pump, dinha na siyang basis mo. So, means say 30 meters, millimeters mercury pa mataas ka. So, means say instead of 130, kaya ang first one ng BP was there, mapataas ka another 30. So, 130 plus 30, that's S160.
So, radial
so,
rin check. Dili sa Beckel.
Now, with the use now of your, make sure it's safe, yes. With the use now of the stethoscope. Okay. So what's important with the stethoscope, you use most especially if you're placing it on the chest of the patient, you make sure that you warm this one, ha? You warm good. And then kani, I don't know where is. Yeah, the cheaper ones. Joke.
Grabe naman yan.
Yes, cheaper ones man good siya. Ang problema is dili agad mo pick up ang mga sound with na tinarong. Okay, sige. Now, this one is the diaphragm. This one is the bell. Okay, commonly we use the diaphragm here, okay, to listen for the sound. Okay, and then we make sure na open siya. Alright? So, on na siya. If it's not on, i-switch mo siya first. Okay, i-turn mo siya counterclockwise. Okay, and then after that, what you do is, you warm. And make sure na nakasanitize. Okay, and then you place it on the brachial artery. Relax ka na. Nalalay ko dyan. Very stiff ba? As much as possible, you don't hold this part here, ha? You don't hold this part. Kasi sensitive din siyang apart. So, most likely, ang thumb mo nang ma-hear siyang imo ang stethoscope mismo. Alright? Kita mo? So, 160. Okay, din natin. Kita mo? Kami na. I'm not counting anymore ka ng mga ano ha, like say 142 or 143, I'm not counting that anymore. Okay, by tens na tabas na yung ano ginagamit natin. Ay, nakagimod. Anyway, sige, basi na-alter ha. So you have to really check it and at the same time compare it with the other hand. If you've noticed here, very important ha. Diba I've asked you last time, kanang, which one has the stronger pulse? Is it the left or the right side?
The left.
Ang left na naman. When your heart is actually beating, ang first na siya nga flow, sang imo ang blood is on the left side. They get it. Okay, you have the left ventricle there, so most likely din na nagagawas ang imo ang blood. The reason why, if you've noticed, particular ko, kung asa ko gipasit down ang patient ko, because mas stronger siya expected sa left than the right. But, I'm just assuming at this point in time, say, dito ko sure. Okay, it's the first time that I've checked the BP of this patient. But if, say, for example, kamo, na-check ng BP ninyo, and then for several times, when I say several times, hindi ka na makaingon nga, ang BP niya taas. Okay, it's because nakakuha ko at this point in time 130 over 90. You won't assume it like that. Nga naman, several consecutive pa man na siyang readings. They get it. Okay, before we say na taas mo ng iyahang BP. And then even in the day, you have to take it like morning, lunch, after a night. They get it. Or at least twice. Okay, let's see the left, the right side. Okay, take note that once your patient is, or sorry. Once the person is actually moving, there could be possible changes sa iyang BP. Because you have patients who might be suffering from what you call your orthostatic hypotension, meaning to say from lying down, pag abruptly na siya nag-change sa iyang position, ang cellphone din naalayo na sa tagpalong anak be. Okay, pagka-change na ana sa iyang position, kanang BP ma-drop na siya eventually. The reason why there are some people most likely who wake up early in the morning, kay mo adto sa CR, and then they are found dead. Okay, early in the morning. That's commonly happening, most especially sa mga adult people. Okay, most especially sa mga elderly. It's basically because there is a change or a shift in the pressure of blood that is passing all throughout the body itself. Do you get it? So meaning to say that pressure of blood change, okay, most likely will also have an ill effect sa heart. So if that person's heart is maybe a failing heart, not 100% really functioning na, kay adult naman go, there could be a tendency nga mamatay na isang tao. Do you get it? That's why if from lying, even siguro at this point in time, kamo, lalabad ang ulo ninyo upon waking up, most especially if kanang makuratan ka, or kanang na-late na di ay ka, correct? And then, say for example, kanang nag-shift ka, na naka-wake up ka, tapos na ang cellphone din na, tapos yung anak rin ang cellphone, labad na doon. Total na. Sige. Let's try. Ang puyaw, by the way, the puyaw or the anxiety, that could be normal. As I've mentioned, there is such thing that we would call as your white coat syndrome. Okay? It's your white coat syndrome. Meaning to say, at some point, nag-override ang imong brain. Okay? Most likely, wherein it's manifesting physiologically. That's why sa register sa vital signs, it becomes different. Most especially when we talk about pressure changes. So say for example, Owen told me like, naku yung 1 ko, kay 140, that can be valid. But for us, like for me, for example, to say, because I cannot diagnose the patient they get it, kasi I'm not a doctor. We have here checking with the vital signs because this is again our baseline rin siya. But this could be one thing that would tell us, no, oops, there could be something wrong here. Okay? Why is that so? Sorry, why is that so? Other than me taking the vital signs, I need to notice some signs or possible symptoms that are manifested by my client. Why is that so? That's why I try to do or make a conversation that could be helpful in assessing my client. Say for example, taas ang register sa nga BP. That's why I ask nga, ma'am, nakapacheck na ba ka BP niyo before? Kamusta ang register? Okay, why? I would say that at this age, medyo the body size may not be of normal BMI. Do you agree with me? Okay? During my age, actually, hindi na nakada kong body ko, but because of the coping mechanisms and the lifestyle changes most likely that we are adapting to right now, eventually it becomes like that. They get it. And to some of you also, it might be that you're not feeling anything else. Okay, that's why wala ka na alarm. They get it. But technically speaking, if kanang siguraduon good na to, checking on your BMI, you are not within your BMI. Do you get my point here? You might not be feeling something, that's why hindi ka ma-alarm. But like say for example, some of you, sige kagbuyod. Some of you, sige sakit ni mo dinhi. And then learning also from the theories that you have, eventually, that will suggest, sometimes, you go praning. Mura kag mapraning, ano man. Daghan man ka nahibaw-an. And to some point, sometimes, you are more on the anxious part, rather than maybe rationalizing, what could I do better? To better myself also, since I'm a caregiver. You get it? Okay, let's check. Now another, by the way, this one, the clef, I think you know how to use this one already. So dinhin na ni siya, muning iyang purpose. Do you get this? Muning purpose ang clef niyo ha? Okay. Kaya na ako dahil siya. I-clip siya dahil.
I-clip dahil.
Ayaw yan na ano. Ayaw ba kasi kung taas, ayaw.
Nawag ko, pwede.
Relax sa kama. You make sure ha, your patient naka 30 minutes rest din siya ha. Or the least 15 minutes. So arriving from school, tapos din ako sa center of
Region sa'yo, dito mo tuwa din. Region sa'yo, una.
Birthday niya rin. Lagi ko cake.
What the dating? Living apart. So this is what I'm telling you. There is a difference between the left and the right side. Ang register sa iyaha nga, right side, it's 120/80. Ang sa left side mo is 140/90. So a difference between 10 to 30 millimeters mercury, most likely. Do you get it? Sige. Now, these are only, like say for example, with the clinical eye of a person who's doing the assessment, you get to ask questions pertinent sa iyaha. Kaya nga naman, relevant mang isa. So, would I say now, nga kaning patient ko is hypertensive? Would I be alarmed now nga dako ang difference between the left and the right side? Definitely not. Nga naman, ang aton margin between the left and the right side has to be at least 10 to 30 millimeters mercury. Do you get it? Do you get it? So other side, systolic ya is 140. Other side, systolic ya is 120. Other side, diastolic ya is 90. Other side, diastolic ya is 80. So naa siya difference, but that would still be okay. Nakapata siya range mismo. But what would be alarming on the end, okay, that I've got that first time will be nagkat-kat na siya 140. Take note, a 120/80 BP could be normal in adults. Do you get it? Normal siya, meaning to say, pag nisa ka pa like over 120, that might tell you, oops, there could be something wrong here. But for us to say na possibly na ay problema, you have to take it again. Okay, what's the best time actually to check the BP? What's the best time?
5 minutes apart.
Best time to
When you
take
wake
the
up.
BP is pagkamata right away. That is 1 hour after waking up and before you sleep.
Yes.
Do you get it? So kamo, if you have the BP with you, you can have your BP checked. You can maybe teach someone sa inyong household to also do this one. So you can actually also monitor. Now, it's only nice for you to hear me saying this. But frankly speaking, at some point, ang sa ato ang mindset, wala mang good nga kanang I'll take care of myself and I know that these are the vitals here that are normal. So these are actually supposed to be my target and this one has to be observed. Pero ang problema man sa ato, most especially Filipino ta, the healthcare system is not fully functioning well. And financially, na ana siya implication, we only go to the hospital and see consultation kung naanay problema. Do you get it? So since to your advantage na ang knowing how to take vital signs, in a real sense of a word, of taking the vital signs, kindly do it properly so that you also get to assess yourself and at the same time people also around you. Do you get it? Sige, you take your vital signs, Smith. And then you time, like how many minutes do you do that? Okay, all vital signs na. PPR, BP, oxy.